Welcome to my channel, where medical topics are made easy. But don't worry, we're here to shed some light on this often misunderstood condition. In the next few minutes, we'll cover everything from what hemorrhoids actually are to symptoms, causes, effective home strategies, and even medical solutions. So if you VA ever experience the awkwardness or embarrassment of hemorrhoid symptoms, or maybe you just curious, keep watching. We've got you covered. And if you find this video helpful, please don't forget to hit that like button and subscribe for more health insights. Let's get started. First things first, let's break down exactly what hemorrhoids are. Picture this: your rectum and anus, the last parts of your digestive tract located at the very end of your digestive system, where everything from food to waste travels through. They might sound small, but they play a huge role in helping the process of going number two by providing that extra oomph to move things along. And let me tell you, without them, things could get a little sluggish down under. However, sometimes these veins can get swollen or inflamed, forming clusters that we call hemorrhoids. We've got two main types: internal hemorrhoids found inside the rectum and external hemorrhoids hanging outside the anus. And while they both do the same job, their locations can lead to slightly different experiences. Internal hemorrhoids, those sneaky fellows residing inside the rectum, often don't come with any noticeable symptoms unless they start bulging or bleeding. External hemorrhoids, on the other hand, those hanging outside the anus, are a bit more vocal, sometimes causing itching, pain, or a lump in your nether regions. You might be wondering, what's the deal with the bleeding? If you notice bright red blood on your stool or toilet paper, it could be your inner hemorrhoids waving hello. So now you're probably wondering, what's behind these swollen veins? Well, there are several culprits. One of the most frequent suspects is chronic constipation. Yes, straining on the porcelain throne can worsen hemorrhoids. Another one is a diet lacking in fiber. We're talking about those essential nutrients found in fruits, veggies, and whole grains that keep things moving smoothly in your guts. Low fiber means less than ideal bowel movements. Pressure from pregnancy or obesity can also take a toll on your hemorrhoids, making them swell up and feel uncomfortable. For those who spend a lot of time sitting down, jobs requiring long periods of sitting or standing in one place can contribute to the problem. It's like torture for your tailbone. Basically, any activity that puts pressure on your pelvic area can aggravate hemorrhoids, turning your behind into a battleground. Now that we know the culprits, let's talk about the warning signs. It's crucial to be aware of your body's signals. The most prominent symptom is, of course, bleeding. We're talking about bright red blood. If you spot this on your toilet paper or stool, consider checking in with your doctor. Then we have prolapsed hemorrhoids, which means they're sticking out of the anus. Imagine them as the shy ones peeking out when they shouldn't. Now, we all know accidents happen. So if you experience a sudden onset of bleeding after a vigorous activity or heavy lifting, it's wise to take a peek downstairs. Check for any obvious signs like skin, tears, or rashes. Hemorrhoids usually aren't life-threatening, but it's always smart to check in with your doctor for an accurate diagnosis and advice. When it comes to hemorrhoid symptoms, it's important to remember that severity varies. Some people might experience minor annoyances, while others might face more intense discomfort. Also, everyone's different and symptoms might come and go or stick around. But regardless of the severity or duration, it's wise to listen to your body's cues. After all, understanding what's going on below is the first step towards feeling better up above. So let's discuss some at-home strategies to find some relief. First, let's focus on what goes in your diet. Fiber is your best friend. And when we say fiber, we mean the kind found in whole foods like fruits, vegetables, and whole grains. It's all about keeping things moving down under and preventing constipation. A little tip from us here: foods like prunes can work wonders. Staying well hydrated is equally important. Water helps soften the stool and keeps things running smoothly. Next, let's talk about bathroom habits. No straining or pushing, especially if you're already dealing with hemorrhoids. Straining can worsen the symptoms. Instead, take your time and relax. If you're finding it hard to go, try using a footstool to elevate your feet. This can help with the downward flow. Just make sure to avoid spending too much time on the throne. These can soothe the itchiness and pain around the anus. But remember, choose products designed specifically for sensitive areas. Last but not least, let's talk about movement. Standing up and walking around can help stimulate circulation and reduce swelling. Regular exercise can also boost overall health and reduce the strain on your lower body. So what if at-home remedies aren't cutting it? There are medical treatments available. But before we dive into those, let's address a quick question. How do you know if your hemorrhoids are actually a cause for concern? Well, here are some key indicators. Severe pain or swelling around the anus, changes in your bowel habits, either constipation or diarrhea, a family history of colorectal issues. If you notice any of these red flags, it's time to schedule a visit with your doctor. It's essential to have accurate information and resources to help manage symptoms. That's where medical professionals come in. But before visiting the doctor, you can prepare by noting down your symptoms, their severity and frequency. Additionally, jotting down any questions you have will ensure you get the answers you need. This proactive approach to health not only helps in managing hemorrhoids, but also builds a stronger patient-doctor relationship. Now, let's explore some common procedures and treatments for hemorrhoids. Many online videos provide misleading or outdated information, according to studies published in the Turkish Journal of Coloproctology and indexed in PubMed. That's why it's essential to rely on credible sources for your health information. First up, rubber band ligation, a minimally invasive procedure where tiny rubber bands are placed at the base of the hemorrhoids to cut off blood supply, causing them to shrink and disappear. Infrared coagulation uses heat to shrink hemorrhoids, usually done with special tools like infrared photocoagulation or bipolar electrocoagulation. Advanced options include a hemorrhoidectomy, where the surgeon removes the hemorrhoids. However, this is typically considered when other methods are not suitable. Now, let's talk about what you can do to prevent hemorrhoid. And if you find this video helpful so far, don't forget to hit that like button. It really helps us grow. First, prioritize a balanced diet rich in fiber. We've already talked about the benefits of fiber, so let's re-emphasize its importance. Think of it as your gut's personal lubricant. It keeps things moving smoothly and prevents constipation, which can aggravate hemorrhoids. To incorporate more fiber into your diet, start by adding a couple of servings of fruits and vegetables to your daily meals. Gradually increase your intake to reach the recommended amount of 25 to 30 grams of fiber per day. Second, stay hydrated. We've all heard the saying, water is life. And for your digestive system, it's water that keeps things flushed and functioning properly. But remember, everyone is different. Some may need more or less. Listen to your body's cues. Third, establish good bathroom habits. This means no straining and no holding it when nature's calling. Straining can worsen hemorrhoid symptoms, while holding it for too long can lead to complications. Make time to attend to your needs promptly. Fourth, incorporate regular exercise into your routine. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Activities like brisk walking can be beneficial. Fifth, maintain a healthy weight. Excess weight can put added pressure on your hemorrhoids. If you're carrying extra pounds, consider making lifestyle changes or seeking guidance from a healthcare professional. Finally, be mindful of what you eat. Certain foods like spicy or acidic items can irritate hemorrhoid tissues. Remember, your bottom end deserves as much care and attention as the rest of you. By following these tips, you're not just taking charge of your hemorrhoid symptoms, you're investing in your overall well-being. If you've made it this far, thank you for joining us on this journey through the not-so-glamorous world of hemorrhoids. We hope we've demystified these common yet often embarrassing symptoms and provided you with actionable steps towards a more comfortable, happier you. If you're looking for additional tips on maintaining digestive health, check out our related content, Best Foods for Digestive Health. Thanks for watching.